Speaking of good things in Madison County going on, we had a couple of guests on from the Madison County Health Department. Ava Wright with the HANDS program. She is the coordinator for the HANDS program. And we also had Kelly McBride on. So and she's going to talk about a special program. Buckle up, phone down, and then Ava's going to talk about cribs for kids. And we've got that interview. So let's watch Ava right now.
Welcome back, everyone. We are so pleased to have Ava Wright, who is the HANDS Program Coordinator for the Madison County Health Department, joining us this evening. Ava, so nice to see you.
It's really glad to be back with you guys.
Nice to see you, Ava.
It's been a little bit. So, Ava, tell us what you have going on at the Madison County Health Department right now.
Well, I'm really excited. Kelly asked me if I would be willing to share with you all in your program, and I was didn't hesitate 1 minute because this is so important for our community. And what we have going on right now, it's not really through our HANDS program, it's actually through the Maternal Child Health Program through the state, but we are coordinating it, and it is the Cribs for Kids program. And very, very important program for our community. What Cribs for Kids main mission is to provide safe sleep environments for families, and we know it's important for all families in the United States. There's sadly about 3,500 deaths related to SIDS every year, and so what we're trying to do is prevent that and educate families and provide a safe crib for those families that need one. So it's very, it's just a priority that we get these cribs out. We have quite a few, and we're ready to issue those to families that have an interest. What they need to do is just call our health department, our HANDS program. I think I gave you guys the information, the number 626-4263, and just express that interest. And what we'll do is provide a safe sleep assessment and talk with the families a little bit about the program.
So, Ava, the cribs, tell us what the requirements are as far as the cribs. What makes these cribs special?
Sure. The Cribs for Kids are federally safe. They're through the Consumer Product. I've got that name right here. Hold on.
Sure. Although you're fine.
Consumer Product Safety approved cribs. And
okay, gotcha.
The brand we have is Cribette, and it's been approved. We also have, I'm really excited. It doesn't take much to get me excited, but it's really exciting. We have a little packet that goes with the cribs, and there's a safe sleep blanket, so it's a sleeper blanket.
Oh, nice.
Because, in a minute, I'm going to talk to you a little bit about some safety things with safe sleep, but it's wonderful. We don't want to have extra things in the cribs that the animal below that. And it's an educational packet, so we have those available that go with the crib along with a fitted sheet for that crib. And it's like a bassinet crib, so it's really good for infants all the way up, until they're older.
That's really neat. That's really neat. So they can pick those up. They got call the number first, correct, and then pick those up at the Madison County Health Department. Yes,
call us. We'll do a safe sleep assessment.
Yes.
There we go. And there's a video that they have to watch on how to crib together and how to take it down, because it's a portable crib. I want to emphasize that.
Sure.
And then they just need to stop by and see us, and we'll go over the information and sign a little bit of paperwork, and it's free for the family.
Excellent.
There's no charge. And so it's a great program. I want every crib out of the health department. I need those cribs to be issued to families. I don't want to set them.
Right. Fantastic. Well, that's excellent, Ava.
Ava, tell us a little bit about those safe sleep steps that you were just referring to. I know that this education is critical. Can you walk us through that?
I can. So it's very simple educational tool. It's the ABCDs of safe sleep. And you can always go to the Safe Sleep Kentucky or KY website to read about those and reference back to those. But basically what we have are A is for alone. And so we don't want to, when we think about the baby, we want the baby to sleep alone. So no co-sleeping, sleeping on the couch. As soon as that infant falls asleep, whether they're in a carrier, in your arms, they need to go to that safe sleep environment. And the Cribs for Kids crib is a place that's a safe environment for that baby. We do recommend that at least for the first 6 months to a year that the crib actually is in the parent's bedroom. And that is something that I did not realize. I was reading about it recently, and so a lot of times we have the nursery, and we want to have that.
Yes,
that's a great
right.
time for families to prepare. But really putting that baby in a safe crib or bassinet in the bedroom of the parent is the safest recommendation, especially in those early first months.
Sure.
And then also we always say back to sleep. So we're not putting the baby on their stomach when we put them alone in a safe sleep environment. We're putting them on their back. And that guidance has been around for over 20 years, but just to emphasize that. So alone is the A.
Okay.
Next is B for back. So put the baby, the infant on their back for sleep, fall asleep. And the C is for crib. So back to the original discussion,
Sure.
the baby needs to go in the crib. There's a lot of deaths related to that co-sleeping, unfortunately. And so it's just very important that families work together and educate one another, even when the baby's sleeping over like at a grandparent's or a family member or the babysitter. Everyone needs to know that information. Right. Last is danger. So D for danger, and that is it's a dangerous environment when someone is drinking or using drugs when they're caring for a child. And so that will view your ability.
Right.
So all of the factors that sleeping alone, putting the baby on their back, using a crib for sleep, and then abstaining from substance use when caring for a child are critical in preventing sudden infant death.
Okay, well that's pretty cool. The A, B, C, and D. Okay, Ava, I'm going to try to get this correct. Okay. All right. I don't know. I'm going to do this without looking, and so Colleen, don't make fun of me. And I'm kind of embarrassed because I forgot what A was. Ava. A for Ava? That's not right.
There you go, but not Ava. Alone.
Alone. Okay, good. Okay, alone. And then back, make sure they're sleeping on their back. Okay, alone. And then C is for crib, which is what you're handing out, correct?
Yes.
Okay, and then D is danger. Don't take anything that would affect your ability to care for the child, drugs, alcohol, anything like that, correct?
That's correct. That's awesome. It's pretty simple.
That's not too bad. I mean, I didn't even look. I didn't even look at my notes.
That's great. So it really is, the Safe Sleep Kentucky has a lot of other education and tips that go along with that ABCD. So I touched on just the basics.
Sure.
But there's a lot more information if you go there and read about it.
Right.
And then we also give that education to families.
Okay.
Even if you have a crib and you feel like your child has a safe environment, you can still call us to talk to us about how you can keep your baby safe.
Okay. Cool.
Or feel free to call for any questions.
Right.
And refer families out if you do not have an infant in your family right now or a young child that would need one. Keep us in mind.
Cool.
And we just want to get those cribs out. We do have hours 8 to 6 on Monday.
Okay. 8
to 30 on Tuesday through Thursday, Friday 8 to noon. So if we're not in, you can leave a message and we'll call you back.
Excellent. I just come up with a slogan in my head. I know sometimes Colleen and Kelly make fun of my slogans, but I've got a great slogan, Colleen. Call the Madison County Health Department and put our crib in your crib.
Wow.
I love it.
That is unique.
That is exactly what we're trying to do. That sums it up so well.
Excellent. That's fantastic, Ava. And for more information on this, they can always call the health department and visit the website, I'm sure.
That's right. And if you have any questions about HANDS, our Helping and Nurturing Developmental Services, which we've talked about before, pregnant moms with new babies up to 3, give us a call. We have a great program. It's free as well. All this is federally funded, so don't forget about our program with HANDS. You don't have to be part of the HANDS program to receive the crib, though.
Excellent. That's fantastic.
Ava, thank you so much. These are such excellent resources, and you do an amazing job at keeping our families safe here in Madison County. We greatly appreciate you.
Well, it's my pleasure, and it's my mission, and it's the health department's mission to take care of our families. Thank you.
You do a fantastic job. All right, folks, we'll be right back.
And put the crib in your crib.
Amen.
Thanks, Ava.
This message is brought to you by the Madison County Health Department. When it comes to breast cancer screening and treatment, one size does not fit all. Some risk factors put women at higher risk for getting breast cancer. Having a risk factor does not mean you will get the disease, and not all risk factors have the same effect. Talk to your doctor about ways you can lower your risk for breast cancer and schedule your mammogram today. If you have questions, call the Madison County Health Department in Richmond at 623-7312.